My name is Malik El-Moayed, one of the physicians here at Northwestern Medicine. I'm an assistant professor in the Division of Endocrinology. I've been doing research on zinc and beta cells for over 10 years now. My research focuses on the influence of exposure to various elements in our diet and environment on our health, in particular on type 2 diabetes risk. My special focus in this area is a series of elements called metals and metalloids. Some of these are essential metals, such as zinc and selenium, that are required by our body for certain functions, and deficiency in these can lead to certain disease processes, but also there's a potential for excess supply of these to lead to adverse outcomes. Other metals that I'm looking at are non-essential metals. These are essentially metals that have no functional role in our bodies, and excess supply of these may actually also lead to toxic effects. Among these elements can be, for instance, toxic elements as cadmium, lead, mercury, arsenic. Key findings from the current study that is currently in press is that we looked at the concentration of a series of elements in urine samples of about 1,000 mothers and 1,000 offsprings, most of them as mother-offspring pairs, derived from a large international study led by Northwestern University and conducted in 10 international sites, the hyperglycemia and adverse pregnancy outcome follow-up study. What we found is that the concentration of zinc is in the urine is correlated with a higher level of glucose on the 2-hour glucose tolerance test, i.e. higher levels of zinc correlate with higher levels of glucose on a 2-hour glucose tolerance test, both in mothers and offsprings. This is in line with a recent study that was also published by a different group, by Galvez et al. Out of Columbia University, that looked prospectively at a cohort in the Strong Heart study, where they examined the level of zinc at the beginning of the study in the urine, and then followed these people over time. And what they showed is that people with higher levels of zinc may have a higher risk for developing type 2 diabetes down the line. So taking these studies together, this may suggest that a higher level of supply of zinc, i.e. intake of zinc, may pose a risk for diabetes if that intake of zinc is in excessive amounts. Pre-diabetes and a higher level of glucose on a 2-hour glucose tolerance test shows an increased risk for developing diabetes down the road. So this is important from a public health perspective. There was some controversy about the relationship of zinc and dysglycemia. Some earlier studies had shown that there's a high level of zinc in urine samples from people with fully established type 2 diabetes. The thought was that this just indicates that there's changes in the kidney as a result of diabetes that renders the kidney unable to reabsorb the zinc and thereby increase the secretion of zinc in the urine. However, our study suggests that a higher level of zinc precedes the development of dysglycemia, thereby suggesting that an increased supply of zinc may increase the risk for dysglycemia and ultimately type 2 diabetes. So does this mean that selenium and zinc increase the risk for diabetes? Potentially, although there's more studies needed for sure to confirm this conclusively. The evidence for selenium at this point is quite good. There's quite a few studies that show that supplementation with excessive amounts of selenium increase the risk for diabetes. However, the evidence is less clear for zinc. Our studies point towards that direction, that too much supplementation of zinc may increase the risk for diabetes. The reason why some people think that zinc may be good for people with risk for diabetes is that cells that make the insulin, the beta cells, contain high concentrations of zinc. However, experimental evidence, as well as the current studies that I just discussed, may point towards too much zinc being detrimental to the health of beta cells and potentially other factors influencing the risk for diabetes negatively. Does this mean that although zinc is essential, taking too much of it causes or increases the risk for diabetes? Potentially. As discussed, more studies are needed. And what's mostly needed is supplementation studies. Some of these have been done, but they were mostly too short in duration, and the results very mixed. So more studies in that direction are needed. And there's good examples of several elements that are essential to our health. If we take too much of these elements, detrimental health effects can ensue. A classical example is sodium. We all need sodium for various functions in our body, but in our current diet, we take in too much sodium for our good, and this is a good example of too much of a good thing can be a bad thing. Excess intake of sodium can increase the risk for hypertension, for instance. Same can be true for people who are unable to excrete excess amounts of iron or copper. This can lead to accumulation of these elements, copper and iron, in various organs in our body, leading to what we call Wilson's disease or hemochromatosis for copper and iron, respectively. So these are examples of, yes, essential elements can sometimes be detrimental in excess amounts in our body. So the main take-home message that I would suggest and I recommend to my patients is stay away from supplementation with selenium and zinc for the purpose of prevention of diabetes. Unless there's a proven deficiency, for instance, in people who can't absorb any of these elements, supplementation may actually do more bad than good.